Hello, my name is Caleb Smith with the Rocket Miner newspaper, here to provide your news update for July 1st, 2020. Sorry, this is a little bit later than usual. We've had a bit of breaking news this evening, and let's try to cram it all in, shall we? First off, let's go to Sweetwater County Travel and Tourism, which celebrated an open house for its new visitor center. It's at 1641 Elk Street. You were lucky enough to drop by today. You got a bag with this, got all sorts of good stuff. Information, coupons, other swag. I can't show you the candy, I've already eaten it all. The idea is whether you're a local who wants to explore the area where you're blessed to live, you have friends or family traveling through and you want to show them the sights, or maybe you might have someone like, where's the visitor center? You can direct them. Like I said, that's 1641 Elk Street. Lots of maps, information, people to give you advice and directions on your way. Also this evening, Western Wyoming Community College Board of Trustees met in a virtual meeting. After an executive session on personnel issues, they decided to extend the contract of President Kim Dale by 1 year. She's the one who took over previously, July. Her first contract today was actually July 1st, 2019, replacing Dr. Carla Leach, who retired. Governor Mark Gordon and other state officials had one of their semi-regular press conferences today. One of the primary speakers was Superintendent of Schools, Jillian Ballo. She talked about how it's one question, and one question only, that she always gets is, will schools open in the fall? And she did not give a definitive answer to that because we're a bit of ways today and we can't know today what's going to be coming then. But she did outline stages and that they're looking at, the factors they've been taking into account, and just an idea of what people can expect. The Wyoming Tribune-Eagle is reporting that lunch in classrooms, widespread hand sanitizer, and face coverings are what Wyoming students can expect to see if the school's able to go with their preferred option, which is in-person instruction this fall. The superintendent said that there are 3 phases. The first, and she qualified, this is where we're at, is open with some restrictions such as face masks and social distancing. The relaxation of some previous health orders have granted schools and colleges to be able to do so. And the hope, and honestly, for a lot of people, very, very strong desire, is to be able to take advantage of this. I think we all appreciate teachers a little bit more for what they do, especially if you've been doing a little bit of home tutoring or with your kids in your home. There'd still be some extra expectations, even if schools open. The Tribune-Eagle's noting that parents would be expected to screen their children daily for COVID-19 before sending them off to school. Other recommendations, these aren't official procedures, but this is kind of like the guidelines framework that school districts were offered, and each district will have, each community will have the idea to weigh in on this. Ballo stressed that communities know best. Just talking about how it may be a little bit different from place to place, but still to expect things like serving students in classrooms or pods or designated areas rather than in cafeterias or common areas, and provide water sources other than water fountains. That would be the guidelines over 1. Like I said, that's where we're at right now. 2 would be, they described it a hybrid option, which would be some in-person interaction with possible intermittent closure or quarantine, such as if there was an outbreak at a school, or maybe it would just be limited to a couple staff members. Third would be what we had to do in the spring, and that would be buildings closed to students, virtual online being the option that people are having. The A press release issued by the State Department of Health noted that also gave a framework for what to do if a student or staff member tested positive. The individual who tests positive would enter into self-isolation, and quote, other students and staff members who also came into close contact with the positive case will be quarantined for 14 days or as otherwise directed. This could also mean a school or building could be closed by the state or local health directive or order for a 2 to 5 day period, possibly longer if conditions warranted, to sanitize the facility and conduct an investigation. One of the other things to note, Department of Education stresses that students who are more at risk of contracting the virus or living with someone who is, they would be eligible to receive remote education. Both when it comes to decision making and how it's implemented and how well people follow the same advice that we're getting. Wash your hands, distancing, face mask, all that stuff. The superintendent of school says it's in the hands of your community. It's the hand of our communities. This is something that was noted at Monday's media conference with county officials. And I know we've touched upon this both in the print edition, online, and some other videos. Kim Leon Berger, who's the director of community nursing, said, we're definitely seeing more infections. People are interacting with people more. People are going places when they're not feeling well and don't realize it, but they're infectious. She said, and other people have said this at the county level, state level, even I've seen some federal officials talking about, we know what the expectations are. We're just not always following it. It's anticipated we're going to see more cases. That's obvious. Nobody denied that. It's still a concern, though, because there is a tipping point. One of the things Kim said on Monday that didn't make it into our draft of the story was she kind of asked a rhetorical question. At that time, we had 78 positive cases. We'll get to the number shortly. But she said, why worry about 78 out of about 40,000 people in the county? Why consider that an issue? If you do numbers, it's very small. And she said, you never know when 78 cases will turn into 1,000 cases super fast. And even if the cases aren't here, they can have an impact. Something that was noted by Dr. Case with Memorial Hospital, Sweetwater County, and came up in the governor's press conference day with Dr. Alexius Harris, the state health officer, is that there are hot spots around us. While they're not here, and we are very blessed to be here, there are much higher risk areas to hunker down for a pandemic than we are enjoying Wyoming, and I'm thankful for that. I think most of us are too. That doesn't mean that there aren't hotspots burning elsewhere, and there are some other places where hospitals are being overwhelmed. Specifically, Dr. Case noted that the University of Utah, which Memorial Hospital, Sweetwater County, has a partnership with and is often able to send cases deserving more care to. University of Utah is near capacity, which could make it difficult for us to be able to transport patients from here to there. Just pausing to pivot to the figures. Statewide, we have 1,203 laboratory confirmed cases, 311 probable cases, and 20 COVID-19 related deaths. Recoveries, we have 1,119 people have recovered, and that includes 47 people who have recovered in Sweetwater County. It's more specifically in Sweetwater County. We're now up to 80 lab confirmed cases and 9 probable. Across the United States, Centers for Disease Control and Prevention are saying that we're up to 2,624,873 total cases, which is 43,644 more than yesterday. The national death toll is up to 127,299 people, which is 560 people more than yesterday. Globally, Johns Hopkins University is reporting that we're now at 10,653,987 total cases, which has led to 514,697 people who have died. And our recoveries are at 5,442,749. Hoping that we get to 5,500,000 very soon. One of the things that the governor said today is that he's predicting 3 possible outcomes with where Wyoming's headed. One, he said, we do the right thing, we're able to stay open, and we see progress with our numbers. And that entails doing the common sense we've talked about, staying home when sick, washing your hands, wear a covering. He said, second option would that we reassess some orders, and hopefully in concentrated areas, but we've seen other states that reopen and then started to pull back some of their restrictions. I haven't seen any state fully go into lockdown, and I don't think we're going to see that. I hope we're not going to see that. But you have to acknowledge, if it's happened in other areas, it's even happened. We've watched in some neighboring states where that's happened. You can't deny it's not a possibility here. And third, widespread rollback, possibly to the degree that we didn't even experience back earlier in the spring. Governor says everybody wants number 1. It's the fastest, it's the easiest, it's the least painful. One thing he didn't say, but I'm going to personally vocalize, this isn't the rocket, this is just me, is that this has all come with a cost. We've had our lives disrupted. We've lost traditional celebrations, like the usual way we do graduations, some weddings, funerals, other anniversaries and milestones. People have lost salaries or lost benefits, lost their jobs and businesses. I couldn't tell you right now, but I've lost an untold number of handshakes or back pats or just someone just being able to put their arm around me, or hugs that I recognize those are a greater value than if I would have been asked to try to quantify it just a little while ago. We've already given up a lot, but that doesn't necessarily mean that the sacrifices is over. Something that struck me today is that the virus doesn't care what you've already done or sacrificed. More important is what you did today or what you're going to do tomorrow. On a positive note, Dr. Alexia Harris said that one of the things that time has granted us is that we're better equipped to face the coronavirus. She said that we know more than we did a few months ago. We've had time to make more preparations. We can test more. And like I said, I think the words out there is pretty widespread about stay at home when you're sick, wear face coverings, practice good hygiene, keep your distance. That all said, she said that right now, we are at the highest rate we have seen during this pandemic in Wyoming. And she said that, especially when it comes to the July 4th weekend, our attention to these details, or to these guidelines, are extra important. One of the things about the 4th of July that often coincides is that it's fireworks season. I don't know if you saw even the paper online, the advice from the fire warden talking about please use common sense, don't set off fireworks where you're not supposed to, that type of thing. A little bit of extra care and attention on our part saves us from a much greater cost. Personally, I'm okay with wearing a mask when I go out. It hurts, but I would rather keep a little bit more distance from some people. Wave at them through a car window, or just spend a little bit more time calling them on the phone with the hopes that we'll be here a year from now. Maybe they might be giving Dr. Dale another contract extension, and that person will be there for us to talk about it. Just to close, I'm just going to quote the governor in today's press conference saying, "It is possible to act sensibly and have a good time." I hope everybody has an awesome, safe July 4th weekend. We've got a couple days to go. We got some things to get done first, but I'm hoping that everybody does their part to prove the governor right. Both the acting sensibly, having a good time, and sticking with scenario number 1. This is Caleb Smith with the Rocket Miner newspaper, wishing you a good day, safe tomorrow, happy almost 4th of July.